Welcome to the QCOM MS3 vlog series. My name is Matthew Holt. I'm a student at the Quillen College of Medicine going into my third year, and I'm starting a new vlog series. I did a few of these back during my first year, and it was so cool to look back and see where I was at then and then think about how far we've come. I took a little break during second year. You know how step one is, studying for that exam, and it kind of ramps up during the second year. But this is a time, the third year of medical school, when we're finally getting in the clinics, we're finally getting to do things that we came to medical school in the first place to do. So this is such an encouraging time and a time of great growth and time for personal reflection. So I wanted to go ahead and have my next installment of vlogs. The way it's going to work is I'm going to have about 5 or 6 weeks, depending on the rotation of vlogs, one for each week. Kind of detailing what all goes on. My first rotation, psychiatry, but the focus of this vlog is actually going to be the transition from the dedicated study period for step one into transitions week. It's kind of like a week that gets you up to speed for what clerkships are going to be like. So the main things I want to cover in this vlog are basically going to be what it was like before transitions week, all the things we did during transitions week, and then the student clinician ceremony at the end of transitions week, which was kind of like the capstone experience. So before transitions week, what did it feel like? Well, I took step one and definitely felt like I got hit by a train. But after that, it was like weight was lifted, right? It's so encouraging. You finally finished. You gave it your all. You did everything you could with the time frame that you were presented with, and now we'll find out in 5 or 6 weeks what the score was. So basically, Quillen gives you around 5 or 6 weeks, maybe a little less time after the ending of your second year. Like when classes are over, you get about that much time to study for step one. A lot of students will take it with about a week to spare. So for me, it was something like 4 or 5 weeks of dedicated, and then I took it on a Wednesday, and then I had a whole other week before transitions week started. And so during that week, myself and a few of our other classmates went to Ecuador on a medical mission trip with the Christian Medical and Dental Association. We saw over 1,200 patients. That was awesome. We really got to help those folks out, and it was such an encouraging week and such a just a relaxing week, honestly, after studying for step one for just day in, day out. It was such a grind, but we did it. So now we come into transitions week. And what is transitions week like? Well, it's kind of like going back to classes again. Monday through Wednesday, we had a full schedule, 8 a.m. to 4:30 p.m. with lots of different seminars and things to get us back up to speed on all the things that we could have possibly forgot, while we were studying for STEP, in the real world. And you're seeing patients face to face. It's not a multiple choice question. So they're kind of getting us back up to speed on procedural type things. We had suture workshops. We had how to read an EKG seminars with Dr. Blackwelder. That one's a big hit. I've been in a session with him. Quillen lets you get it 3 different times, like how to read an EKG 3 different times, and you really get pretty good at having a framework for that. We talked about how to read x-rays, lab values. We did sessions in the sim lab with a trauma physician, and she was excellent. Dr. Lasky taught that, and just how do you respond in a trauma situation, or what do you do? What's your role? And so that was really cool. Just all sorts of random things like that. We actually had a session where we did an OSCE on how to use an interpreter effectively. So if you have a patient that doesn't speak the same language as you do, or maybe a patient that's deaf and you have to use sign language. So we got to, learn how to use an interpreter the right way and the most effective way, which is really important because we're going to encounter those situations in practice. And so this won't be the first time we've encountered it. The last thing transitions week had to offer us at the very end, you get tested. So it's basically like a mock step 2 CK. And that's the clinical skills portion of the exam we'll take at the end of our third year. And basically what that looks like is you go in, you see a patient, get a history, physical exam, talk to the patient, figure out what's going on, decide what labs you want to order or tests, come up with your diagnosis and then your treatment plan, and then you have to come out and write a SOAP note, so subjective objective assessment plan. And so this is kind of like a mock scenario where we got 3 patients in a row, 15 minutes in the room with the patient, 10 minutes to come out and write a SOAP note. And we did 3 in a row at our patient simulation lab. They were real patients, like real people, and so that was kind of fun. It was kind of challenging, and it kind of gave me an idea about what the test next year is going to look like. And I'm so excited to learn more, because one thing I learned from doing that was I need to learn more. So it's good. We're starting 3rd year. We're going to learn everything we need to know to be able to take care of folks. So it's really encouraging and exciting. I think we did 2 EHR trainings. We did one in Bristol, one in Johnson City. That's something we've got to get up to speed on, electronic health record, how to fumble through it and figure out when the attending says, what are the labs? I got to know where to go to find those. So that's going to be good to learn those skills. And kind of the capstone experience was the student clinician ceremony. And basically they brought us out to Blackthorn Country Club. We had a really nice dinner. It was excellent food, and we got to spend pretty much the last time our entire class will be together in the same place was there. And so we got to have some great community time. When you get on rotations, everybody's a little split up, right? And so we might not be all in the same room again until match day, that's really exciting too. But this was basically a time of encouragement for us. They hooked us up with some gifts. We got these super sweet clipboards, right? It's got all the lab values, the cheat sheet stuff you need to know, and you can carry it around in your white coat and take notes, what have you. We got pearls of wisdom from just all of these attendings from each of the different departments that basically were selected by older students. And we also got the QCOM manual, which is kind of interesting. It's got everything you need to know. They don't hang you out to dry. They really set you up for success at Quillen, which has always been a plus for me. Just knowing that I'm not going to be thrown into anything without any sort of like preface or any sort of encouragement or mentorship or things like the QCOM manual that I can go look at and see if there was anything that I missed. So overall, it's been such an encouraging week. It's been 0 to 100 real quick, and especially for me because I'm in 2 online courses for my MPH right now as well. I'm taking a gerontology course and also a social and behavioral public health course. So those things are kind of all up on me, and so like I said, coming out of Ecuador, it's been 0 to 100, but it's been encouraging and I really feel prepared. And it feels good to actually put this white coat on and get to wear it occasionally. And, a lot of people view us as the doctor now. We might be the first human being a patient sees in a white coat whenever they get admitted to the hospital or the psych unit or whatever clerkship that we're in. We might be the first student that gets to hear their story, that gets to listen to their heart, and they will view us as their doctor. Even though I've still got a couple years to go, they will look at me like, you're taking care of me. And so there's a weight to that. And that's a weight that each student has to realize through practice, through being there. And so this transitions week has set us up to really be able to have those experiences and reflect on those experiences effectively, because we're not worried about all the other stuff that we forgot while we were studying for step 1. So all in all, transitions week, it's a whirlwind, but it gets you ready and leaves you encouraged for your first clerkship. And so, as always, I'll see you next time.